Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all to my YouTube video channel Comprehensive Pharmacognosy Review. Today's topic under discussion is part 2 of the human nutrition. Discontinue or stop ingesting or drinking cattle cows milk and be careful. Let's start the topic. Part 2 begins with discontinue ingesting cow cattle's milk, be careful. Don't provide it to children as well. The mutant Western cow cattle produces A1 milk, which is considered as bad for health. The old world cow cattle local breed produces A2 milk, which is considered as good for health. Today I would like to discuss the comparison between Western and old world's dairy cows. Old world cow, for example Indian Pakistani cow cattle, has hump and flap beneath the neck, produces milk containing A2 beta casein. The mutant cow, for example Jersey cow, Jersey is not a cow cattle, has no hump and flap, contains both A2 beta casein and A1 beta casein. The local cow cattle has an identification that it has an upper hump and a flap beneath the neck and above the breast. This particular species is not in vogue nowadays. It is due to an oppression of the society on this species. All Western breeds do not possess humps and flaps. The hybridization has changed the entire local breed of the species, which does not possess the humps and flaps. Toxic hormone and others. Scientists are worried, astonished and or surprised that human beings are the creatures who consume the milk of an animal species whose milk turned into poison the world over. The hormone contained in this milk is specifically for the calves of this cow cattle. Due to the consumption of A1 milk, which includes the toxic hormone and others, the magnitude of losses is overwhelming for human beings. This usage results in the prevalence of type 1 diabetes in 60% to 70% of children in Pakistan. We should revert to our forefathers' diet plan and ingest cold pressed white butter. Type 1 diabetes 60% to 70% is caused due to the consumption of A1 milk in children. The mothers of these children must abstain from giving cow cattle milk to them. In yesteryears, if the calf of the local breed of cow cattle expired, this mother cow stopped producing milk for 2 days. This local breed has quite a sensitive species. Insulin-like growth factor IGF is involved in tissue and bone growth, may provoke tumors. Due to higher levels of estrogen and oxytocin, our girls have early onset of menstruation at the ages of 8 to 9 years. High estrogen levels in boys delay their puberty and they have a late formation of the beards. Due to this problem, they have bigger bellies. In the United States of America, a 7-year-old girl in class 1 had menstruation. Regarding these problems, lots of research papers are available on the internet. High estrogen may provoke breast, prostate and endometrial tumors. The recombinant bovine growth hormone RBGH is a cell growth factor. It may promote lameness in the legs, infertility problems and fetal abnormalities. In cows treated with RBGH, significant health problems often develop, including a 50% increase in the risk of lameness, leg and hoof problems, over a 25% increase in the frequency of udder infections, mastitis, and serious animal reproductive problems such as infertility, cystic ovaries, fetal loss, and birth defects. Because RBGH use results in more cases of mastitis, dairy farmers tend to use more antibiotics to combat the infections, the residues of which also may end up in milk and dairy products. These residues can cause allergic reactions in sensitive individuals and contribute to the growth of antibiotic-resistant bacteria, further undermining the efficacy of some antibiotics in fighting human infections. Recent research has also shown that the levels of a hormone called insulin-like growth factor 1 (IFG1) are elevated in dairy products produced from cows treated with RBGH. Canadian and European regulators have found that the FDA completely failed to consider a study that showed how the increased IGF-1 in RBGH milk could survive digestion and make its way into the intestines and bloodstream of consumers. These findings are significant because numerous studies now demonstrate that IGF-1 is an important factor in the growth of cancers of the breast, prostate and colon. Pesticides in GMOs and non-GMOs, for example dioxin and glyphosate, may cause cancer. Due to higher levels of estrogen and oxytocin, Our girls have early onset of menstruation at the ages of 8 to 9 years. High estrogen levels in boys delay their puberty and they have a late formation of the beards. Due to this problem, they have bigger bellies. Exogenous oxytocin leads to adverse health consequences. In the United States of America, a 7-year-old girl in class 1 had menstruation. Regarding these problems, lots of research papers are available on the internet. C-reactive protein CRP is a protein made by the liver. The level of CRP increases when there is inflammation in the body. A simple blood test can check the C-reactive protein level. Due to ingesting A1 protein, CRP is raised. Abstinence from milk decreases the levels of CRP. Newly born human baby is of 3 to 3.5 kg and gains weight up to 7 kg after 6 months. Cattle calf when born is of 35 to 40 kg which gains weight up to 300 kg after 6 months and 700 kg after 1 year due to the injected hormones. Dry milk of all types is A1 protein based. All pediatric milk formulas are A1 protein based. America and Europe have A1 protein milk. In some African countries and Canada, A2 milk is produced in lesser quantity. It is too expensive, $28 per liter to $30 per liter, and the regular A1 milk is $2 per liter. Pakistan had a 100% source of A2 milk inventory in the past, which has been reduced to ashes with the passage of time. In the end, this is the summary of the toxic hormone and others. This is just for your revision. I hope you have enjoyed this video. Have a nice day. It's bye for now.